Welcome to the First 100 podcast, a show where we interview startup founders and leaders to find out exactly how they got their first 10, their first 100 and their first 1,000 customers. My name's Joel. I've been building businesses for a decade now and have been a growth advisor for over 100 teams. Some of you will have heard of by now, but we don't care about me. Our guest today is Dr. Julian Nesbitt, the founder and CEO of the Dr. Julian healthcare platform. Julian, welcome to the show.
Hi, Joe. Thanks for having me.
You're very welcome indeed. I'm very excited to get into this. I've done my research into your company, and I've actually worked in the healthcare sector for a while. It's still in a marketing capacity, so I'm excited to get into some of the nitty gritty. How about we start with what your company does today in its exact form, in your own words, because I won't do it justice.
No problem. So we're basically a mental health aid provider, but also a technology platform in which other services can operate their services on. So we started out trying to improve access to mental health care services by utilizing our network of around 350, 400 clinicians and therapists. And we mainly do that online, so people can find a clinician and we help match people to the right clinician for them. And then we have our technology platform that we've been building now over the last 9 years, in which to really make that process of having mental health care support as seamless and as good as possible, really matching you to the right person, giving you self-help tools and resources that suit, and then all of the sort of administration efficiencies of our back end to make that process of operating a service as good as possible. So the therapy side of things, working with the NHS, working with corporates, private patients also having therapy with us, and then licensing our technology out now as well for other providers to use our platform to operate their services on.
Okay, excellent. So you predominantly you started working B2C and now you're doing a bit of both, B2C and B2B?
Yeah, exactly.
Cool.
So we do.
Okay, so fully understood. Thank you very much. So we find it most useful for the listener for us to start this journey way back where your story of your business began. Could you take us back to that moment? What was going on in your life and what drove you to start this project?
Yeah, so we launched the platform out, started having people coming in to have therapy privately, and then also started working with referrals from the NHS and corporate companies.
Okay, interesting. So it sounded like you had a pretty fully fledged idea all the way back then. Did you launch straight into building that platform, did you? Or is there some sort of step where you thought you'd test the idea, or did it build somehow?
Yeah, I mean, you obviously start out with a terrible platform at the very beginning.
Yeah.
And you go through a massive learning process, and you're constantly sort of pivoting. I think we've ended up 9 years down the line with a very extensive platform that's constantly improving, but mainly because of feedback that we get from the patients and from the clinicians of what would make it better, how can we improve it. So we started out with a crap technology. I think an initial app that was built very cheaply, and I kind of phoned up every patient to apologize for the platform and the technology, but we have really good therapists. And please give us feedback on how you might want to improve what your experience is. And then we constantly then just updated the platform and paid for our technology through our service side of the business, essentially. So that's kind of how that evolved as such.
Absolutely.
Yeah. Cool. It started out purely to provide therapy, but interestingly, the business has expanded into also a SaaS model where we license our technology out, which wasn't sort of the original plan.
No, absolutely. Most businesses find that along the way is that their original plan was a good idea, but it's actually led them to the next path that they're going down. How's that going for you, out of curiosity, in terms of licensing?
Yeah, good. I mean, it's starting to become infrastructure now for some large scale healthcare organizations. So they're kind of using it to operate their services on. And we're doing a few other things. We've got this resource library builder for self-help and actually population level tools. So we're deployed across Cumbria to help people get back to work and to provide self-help and resources. And then because everyone gets their own dashboard, we can actually work out what resources are right for what individual, and we can localize those resources. And therefore we can also then report on it to say, well, what's working, what's not working. So I think we've got a few different things that we're doing using the technology that we now have, based on what the need is essentially. And, everything's about population level support now, etc. So there's lots happening.
Cool. Okay, sorry, I went off on a tangent a little bit there. Back to the early stages. So let's talk about, once you'd got some sort of this early stage platform ready, how did you get your first customers? How did you put it out there? What was step number one for you in this journey?
I think you just have to be persistent to try and I think, go on Facebook, message people, try and find groups, try and do that. You try Google AdWords for the private side of things. You try other paid marketing. That was a varying success because it depends obviously on your cost per acquisition of what that costs, depending on what you make.
9 years ago would have been slightly better than it was today. Was it that you doing it yourself?
Yeah, pretty much. So, I mean, I've only raised a small amount, a bit of angel money. I'm not a VC backed business. I've tried to maintain profitability rather than go down that road. So yeah, our budgets are tight in that sense. So it was more around trying to get word of mouth out there, trying to get more, doing quite a lot of hard graft when it came to the private side of things. And then I've managed to get an initial contract to support an NHS service with their waiting list, and that really helped because that was a referral route in. And then there was a few corporates to help to support their employees and things. And working through partners has really helped in the sense of not needing to sort of go in direct as much B2C, because you can get referrals from a partner in that sense.
Absolutely. So sounds like a big turning point there was that first NHS contract with the referral. So pre that, it was you grinding it out on Facebook groups, trying different marketing strategies. Things worked, some things didn't work. And then that was the turning point.
I reckon, to sort of get some stability. Yeah, for sure.
Absolutely. Cool. Okay, so that was how you got to your first 10. And then I'm assuming with the NHS contract, that's how we jumped the numbers up slightly. Could you talk to me about how, after that day, that next phase of your business where things started to ramp up, how have you been acquiring customers? How have you been keeping customers? What's been running through your mind through that stage?
Yeah, well, I think we're trying to provide the best possible service that we can, and the best personalized service in terms of how the outcomes that you get, and making sure that you're doing what's needed. I think in the world, I think if you're trying to do something that isn't needed, then you don't get customers, or customers don't keep you. So I think with us, it was, can we find a simple concept, or can we get you the right clinician for you, and can we improve the outcomes and make it better than what currently is working out here, what's working now. And naturally that sort of flows through word of mouth, and then people know about you, and then that's kind of how that's grown in that sense.
Yeah, absolutely.
The best service you can.
Cool, excellent. If you don't mind me asking, how many users are you at nowadays? Do you have monthly recurring users number?
We've done around 200,000 sessions ourselves, and then about a million in our SaaS model licensing. So we're at that sort of stage at the moment. Yeah,
absolutely. Okay, so moving from where we were just talking about up to today, have you noticed that your approach to growth or marketing has changed, or have you focused just more on the product and let everything else work itself out?
Yeah, so for me, we've never actually had a sales team or done enough marketing. It's been me going out there, grafting to try and find, a lot of the time it's, using LinkedIn, finding the right person, asking their opinion on things, asking, is this what you need? Rather than directly selling, we found it's always better to get their standpoint. Yeah, so the marketing approaches I found the most successful when I do is under getting to speak to people, and people buy from people, and actually speaking to try and find the right person, and basically getting yourself out there as much as possible, and trying to have as many conversations as possible to find the right partners. I think that helps much more at a more of an enterprise level and a B2B level than obviously from the B2C level. It's all around A, word of mouth, but B, the different marketing strategies, of which can work and can't work depending on what you do and how expensive they are.
Absolutely. You've mentioned a couple of things I'd like to jump into there. Let's start with the B2B route. So you mentioned LinkedIn and starting conversations. How do you nowadays kind of automate that process or systematize the outreach to potential partners?
So what I would do, I would try and define what who you're going to outreach to and what are you trying to gain from that. So for example, if we are using a use case for our resource library for corporates where we can give a branded resource portal for a corporate company, I would be like, well, who's going to buy that? Okay. Or who could that benefit? So I would go, okay, well, actually HR directors, etc. But rather than going buy this, it's more around, could this be of use? Let me get your opinion on is this going to help or not? Can I just ask your advice? And then you tend to have a much better uptake if you're trying to ask for advice and understand it, rather than sort of, because I mean, I'm sure I get bombarded by people trying to sell me things on LinkedIn. It doesn't work. So you come at it from a slightly different approach. Would be my advice on that.
Yeah, absolutely. So I actually run some outreach sequences for clients on LinkedIn. I've done for the last 2 or 3 years. 2 or 3 years ago, it was an absolute gold mine because nobody else was doing it. And now we all have our inboxes completely stuffed to the brim with pitch slaps and other nonsense. So yeah, we've had to find new original ways of starting conversation. And I was curious as to, how you found that process for your own company. So is it all done through your LinkedIn? Have you got several people in the team who are doing the same thing? What does that look like?
We have our sort of company LinkedIn page, but the majority is sort of, I guess, on my LinkedIn, on my profile.
Okay, absolutely. And I've noticed as well that you're quite into LinkedIn content. Is this something you've been doing for a long time?
Yeah, needing to get more back into it. I think it's useful to try and do more thought leadership stuff to get it out there to sort of, I think, it helps to increase your reach a bit, doesn't it? To try and put some thought leadership content out.
Yeah, absolutely.
But
especially if you are running some outreach campaigns of whatever sort, whether they're manual or automated. One of the biggest changes I've seen in our outreach sequences are if the page is actively posting consistently. It can kind of double the response rates overnight. And it doesn't completely make sense, but I guess it means that people are going to your profile, they're seeing how recent it is. If you haven't posted in a month and you're not getting loads of engagement, then they deem you not worthy of a read or a reply. But that's one of the biggest factors, changes. Okay, cool. So skirting off of that, we're chatting about B2B. You mentioned there the word of mouth of the B2C side of things. Have you ever tried to incentivize it? Have you ever tried to encourage word of mouth? What have you looked into for that?
Yes, I mean, that's definitely a strategy. We haven't done that, I think, because when it's talking about healthcare and therapy, it just felt slightly unethical to get people to be paid for that. But it's definitely a way of doing things. I know a lot of people have done it that way. There is ways of doing it where, let's say, a organization might do a referral and they could get a kickback on that referral fee, a referral fee. That's definitely a way of doing things as well. But we haven't done it directly with the sort of patients, refer your friend and get a free therapy session. That hasn't really worked. We haven't done it in that way at this point. But yeah, I mean, it's definitely a way that can work with lots of businesses.
The reason I asked that question is because most founders that I speak to say that we're relying on word of mouth and we are struggling to kind of increase the growth rate because of that. And so I've been exploring for the last few years into the best way to incentivize and kind of throw fuel on that fire. So I always ask that question to anybody who says they're growing by word of mouth. But in general, I guess your approach there is to make the best product possible and the word of mouth will grow naturally. I think that's a lot of people's approach up to a certain point. And then I guess you moved on to the B2B side of things, but some people don't have that as an opportunity. So, Okay, excellent. So we've kind of brought you from right at the start all the way up to today. Is there anything for the future of your growth, of your marketing side of your business that you've got in store?
Well, so we're, I think, doing some more PR stuff that is necessary. Okay. We haven't done enough marketing recently, so we are trying to do a little bit more sort of thought leadership, and then I guess from an SEO perspective, having a better website, so we're updating that, and then actually putting some good quality content out, different blogs that are necessary of the time will naturally drive a bit more traffic in. We just launched our ADHD services and our ADHD pre-screen services, because I don't think everyone needs medication with ADHD. Obviously, some people do, but a lot of the time, having understanding of it with what works for you can help a lot. So we've kind of got different ADHD services, and that is a massive topical thing at the moment. So really trying to put out some good thought leadership around that, we think can help also bring people to you. So I mean, yeah, it's I think the marketing that's worked best for me has been sort of the LinkedIn people approach, but I think there's a whole range of things that we haven't been doing very well on, which we should do, which is more around that sort of getting some SEO done, thought leadership done, etc. And then we can explore again doing Google AdWords, etc. But if you're going to do that, you have to understand what your cost per acquisition is, and rather than lose loads of money. So we found as well, it's better sometimes getting referrals through people. So whether it be a private GP practice or to get them to refer and use partners when it comes to the business that we're operating.
Yeah, sure. So with the paid ad side of things, I often see founders at the start of their projects thinking this is going to change absolutely everything. They put a lot of their budget into it and it all essentially disappears. I think the first bunch of money you spend on paid ads is you learning how not to run paid ads. So unless you're in a position to pay a talented agency or a talented person, or you have the time and money to learn it yourself, I would be cautious of that route. Essentially, you touched on SEO a little bit there. Now, SEO is a very technical skill. Are you, and up to this point, you've mentioned you're doing quite a lot of it yourself, I guess not so much anymore. Would you be, or have you been outsourcing your SEO to someone?
No, and we probably should, but this is where I'm thinking where we would start to try and do that a bit more now. Yes. So making sure that we've got the right, otherwise it's trying to understand what blogs are relevant, what keywords should be helpful to what kind of traffic you might generate, and the different tools that you can use those as well. But
yeah, and I'm no pro at SEO. I'll put my hands up. I've done my own education and I do it for some clients when it's absolutely essential. But I think one of the keys to SEO nowadays is optimizing for AI. Depending on your target market, lots of people are using AI as a search function rather than straight old classic Google. So that's an important thing to keep in mind. Okay, we move on to the next section. So let's move on to mistakes and lessons. So throughout this whole journey, is there anything that really didn't work? We touched on a few things maybe, but is there any big clangers, any marketing mistakes that come to mind to give a warning to anybody else on your similar journey to you as to what to avoid?
Yeah, well, I think the first thing would, paid advertising without realizing what you're doing is a very, very bad idea. You lose a lot of money. That's the big one. Second one is probably hiring sales teams in without having clear structure or actually having a repeatable sales process. I think people I'll hire a salesperson. I have always found that I've kind of done the sales. I suppose when you're better to be founder led at the beginning anyway, as much as possible, until you can have a bit more understanding of that sales, because as a founder, you'll be the best salesman at the beginning anyway. If you can then have a repeatable structure that works, then you can hire the salesperson in to do that. Otherwise, you're just paying someone not to do that because it's not going to necessarily work. So you have to have a repeatable framework.
Absolutely. So it sounds like you went through that experience yourself.
Yeah, you can hire a salesperson, and then it's like impossible because they've got to know what they're doing and how they're doing it. I think is a key thing, and making sure you've got good product fit when you do that.
Absolutely. Yeah, I think a big thing about hiring salespeople is that you need to know that beyond that, once the salesperson has spoken to them, the rest of kind of the funnel of the customer acquisition is all healthy and it works. Otherwise, you're spending money to get these people in here. And then also there's a big problem that salespeople promise the earth and then you can't deliver because that's just how it works. But okay, that's interesting. So paid ads, hiring salespeople before you have the systems all laid out. Is there anything else that springs to mind as something you'd avoid?
I think Yeah, probably those two main things, I'd
That's
say.
all right. Oh,
Yeah.
good. Okay. We're coming to the last section of the podcast now. If you could time travel, moving back to day one of this project, what advice would you give yourself at the start of this journey?
Yeah, I mean, it's every business is a massive roller coaster. So you just learn so much as you go along. I think you've just got to be careful with who the people that you have around you, making sure that you get good advice on certain situations. But sometimes you just have to be resilient and just keep going. If things aren't working, try and understand why they're not working and pivot. Don't keep trying to do something that isn't necessarily working. Understand why it's not working and make sure you can pivot quickly if you're in a startup. I think a lot of it is around resilience, to be honest, because a lot of the things you can't necessarily, you have to kind of go through them to learn them. But yeah, be careful with certain people out there that may not have your best interests at heart. Be careful of that. There's a load of things that you'll learn, but just get good advice around you and someone that you can talk to, I think, is really important.
Excellent. That's excellent advice for anybody in your original position. Okay. Coming to the end of the podcast. Now, if you're still listening to this podcast, I'm guessing it's because Julian's story has resonated with you. So, Julian, where can people connect with you? What should they do if they want to learn more about your company?
Sure. Just find me on LinkedIn is probably the best way. It's just Dr. Julian Nesbitt on LinkedIn, or you can Google Dr. Julian, the company, and have a look at that as well. But yeah, probably LinkedIn. Just connect with me on LinkedIn.
Excellent stuff. Thank you very much, Julian. This has been a pleasure.
Thank you, Joel. Thanks for having me.
That's all right. This has been the First 100 podcast. We will see you in the next episode.